Bismillahirrahmanirrahim. In this video, we are going to talk about opioids that are one of the anesthetic agents. The first thing about opioids is that they act on three receptors: mu, kappa, and delta. Next thing about opioids is that they are antitussives, especially hydrocodone and codeine are used as cough suppressants. They have sedative types of effects and analgesics too. Next thing about opioids is their tolerance. That tolerance develops over time. What does tolerance means? That if you are using opioid on an animal for from a prolonged time, the receptor desensitization will occur. So, in order to have same level of analgesia that it was producing on the initial days of therapy, you have to increase the dose. So with the with the passage of the time, dose gets increased to get the same level of effect. And since if you are using from a prolonged time and you stop that therapy, you are going to have withdrawal signs in that animal, and these signs can be nausea, vomiting, aggression, muscle twitching, anorexia, and muscle weakness. And that is why it is always said that when you stop the opioid therapy in a tapering way, that slowly decrease the dose day by day, rather than suddenly stopping the therapy just in a one day. Opioids have emetic and antiemetic both type of effects. Morphine will produce emetic effect, and antiemetic effects will be produced by fentanyl, butorphanol, and methadone. They have adverse reactions upon injection. That in the body they will cause respiratory depression, heart rate decrease, that is bradycardia, hypotension, and urinary retention. With the rapid IV injection, opioids will cause histamine release in the body, and that histamine will cause anaphylactic shock type response, that is it will cause tachycardia, hypotension, and bronchospasm in the body. One of the biggest side effect of opioid is dysphoria, and it is a common side effect that the animal will vocalize, it will be agitated and and it will show excitement. So when you will inject opioid, these signs are common, that will for sure happen. So don't get panic that like what I like, don't judge your own self that you have done something wrong. No, dysphoria is a very common side effect of. You can treat this dysphoria either by using tranquilizer or sedative uh, with opioids like espromazine or dexmedetomidine. What does tranquilizer and sedatives will do? They will basically calm down and relax the animal. So it will lower the agitation, excitement, or vocalization. But if the dysphoria is very persistent and very significant, you can use the opioid reversal agent, that is opioid antagonist naltrexone. Opioids also have effects on GIT, and those effects are inhibitory. That's why they call colic in horses or post-op constipation. What does these inhibitory effects do? Basically, they decrease the motility and secretion. Specifically talking about morphine, it will reduce or inhibit the motility of colon. So colonic motility is inhibited, and butorphanol will affect on jejunum. So jejunal motility will be inhibited. On the pupil diameter, the opioids will cause meiosis, that is pupil constriction in dogs and rabbits, but mydriasis in cats, horses, and ruminants. Opioids are also available as transdermal patches for analgesia. Buprenorphine and fentanyl are commonly available as transdermal patches. They are also available for humans too, but never use the human preparation for the animal. Next, we will specifically see butorphanol. Butorphanol is a synthetic opioid, mixed agonist and antagonist property. Um, yeah, As far as kappa receptor is concerned, it is a kappa agonist, and through that kappa receptor it will cause the analgesic property, and it is a mu antagonist, through which it will act as a cough suppressant, that is antitussive activity. If we talk about kappa receptor, um, it will through kappa receptor it is producing analgesic activity. So this analgesia will remain less than 2 hours in the dog. So that is a very limited time period. On mu receptor it acts as an antagonist. So it can also be used because of this property that it's a mu antagonist. It can also be used to reverse morphine and or other pure mu agonist agents, but it is less potent mu antagonist than naloxone. So, since butorphanol is a mixed agonist antagonist, you can use it to reverse morphine or other pure mu agonist, but still its effect will be less potent than the antidote of opioids, that is naloxone. Naloxone is a pure mu antagonist. Next, we have in butorphanol is that butorphanol is useful in horses with colic, as its binding to kappa causes pain relief. So, if you have a horse with colic, we know in the treatment of colic, first we try to reduce the pain through any NSAID, and after NSAID like flunixin is most commonly used. But still, if any NSAID is not reducing the pain, then we will straightforward go for the opioids to avoid that pain, and in that butorphanol is a good choice. Butorphanol also provides mild sedation in young, but its effects are higher in older animals. It is used in combination with tranquilizers and sedatives to improve sedative effects. And in healthy horse, head tremors initially occur but dissipate within few minutes. Next we have is fentanyl. Fentanyl is more potent than morphine. Okay. It is given as transdermal patch or continuous rate infusions, but you should remember here that uh, absorption of fentanyl through transdermal patch or CRI will be increased if the body temperature is increased. But if the animal is hypothermic, then the absorption will be reduced. The fentanyl is a lipophilic, so it is absorbed and eliminated quickly. So it is not useful for pain control via single dose administration because its duration of time is very little. It produces good analgesia, but still the limitation still remains that it is absorbed and eliminated quickly, so not useful. Less likely to cause nausea and vomiting as compared to morphine and other mu opioids, but it also has some adverse effects like respiratory depression and dysphoria. Next we have is hydromorphine. Hydromorphine has dysphoria as common side effect, that is also with all other like opioids. And in dysphoria it causes restlessness, agitation, vocalization, lack of response to the surrounding. And to treat dysphoria, you can use tranquilizer or sedative like espromazine or dexmedetomidine. Hydromorphine also causes hyperthermia in the cats. Then we have is buprenorphine. Buprenorphine is a preferred narcotic for pain control in cats. Remember buprenorphine for cat. Why? Because cats have oral mucous membrane that have pH. Like you can see this last line that the pH of feline mouth favors the transmucal absorption of buprenorphine. So it is a preferred narcotic for pain control in cats transmucosally because it is easier to use, because like you can recommend the transdermal patches to the owners at their home too, because owners cannot inject their animal, but they can just let their cat lick or like apply on their in the cat's mouth at their own home rather than taking the cat every time to the hospitals. So it is a easy way. to administer, and cat's mouth, its pH favors this absorption. It is also used in IM or IV line, and through these routes up to 8 hours of pain control is obtained. It is most popular and relied analgesia in cats. Okay, being partial mu agonist, it's not my, it's mu agonist. It does not causes most of the adverse effects of pure mu agonist, like nausea, vomiting, and dysphoria. So that is a good point for buprenorphine. Its duration is long, 6 hours or more, but its onset is also long, that it will take 30 minutes to or in cats and dogs to start acting or start producing its effect within the body. It is difficult to reverse. It is tightly bound to mu receptor. And last we have is an opioid antagonist, naloxone. Uh, it is effective at all receptors, mu, kappa, and delta, but it has greatest activity at mu receptors. So that was all about opioids. I hope you have grasped the clinical properties of all these agents. Thank you so much.